Center Test Prep Exam Answers. Question 1. A patient who has received massive blood transfusion protocol is at risk for which electrolyte abnormality due to citrate preservative in blood products? Option F, hyperkalemia. Option B, hypercalcemia. Option C, hypercalcemia. Option D, hypermagnesemia. The correct answer is option C, hypercalcemia. Citrate, a preservative in transfused blood products, chelates ionized calcium, leading to hypercalcemia, which can cause paresthesias, tetany, and cardiac dysrhythmias. Question 2. A 25-year-old female presents with sudden, severe unilateral lower abdominal pain and vaginal spotting. She has an IUD. The nurse's priority is: Option A, obtain a urine pregnancy test. Option B, administer pain medication. Option C, prepare for pelvic exam only. Option D, discharge with follow-up. The correct answer is option A, obtain a urine pregnancy test. The presentation suggests a possible ruptured ectopic pregnancy, which is a life-threatening emergency. A pregnancy test is the critical first step. An IUD increases the risk of ectopic pregnancy if conception occurs. Question 3. A patient with a history of renal calculi presents with severe flank pain, nausea, and hematuria. The priority intervention is: Option A, forcing oral fluids. Option B, straining all urine. Option C, pain management. Option D, surgical consultation. The correct answer is option C, pain management. While all are appropriate interventions, severe pain from renal colic is excruciating and requires prompt, aggressive pain management as the initial priority. Question 4. A nurse witnesses a colleague diverting narcotics. What is the appropriate initial action? Option A, confront the colleague directly. Option B, report the observation to the charge nurse or manager immediately. Option C, document the observation in the patient's chart. Option D, call the police. The correct answer is option B, report the observation to the charge nurse or manager immediately. The nurse has an ethical and legal duty to report suspected impairment or diversion to the appropriate supervisor immediately. Confrontation can escalate the situation and compromise the investigation. Question 5. A drowning victim who was submerged in cold water has a higher potential for successful resuscitation because: Option A, cold water causes coronary artery dilation. Option B, hypothermia decreases metabolic demand and provides neuroprotection. Option C, cold water flushes the lungs of bacteria. Option D, the mammalian diving reflex eliminates the need for CPR. The correct answer is option B. Hypothermia decreases metabolic demand and provides neuroprotection. The protective effects of hypothermia reduce cerebral metabolic rate and oxygen demand, which can allow for survival and neurological recovery even after prolonged submersion. Question 6. What is the classic sign of a basilar skull fracture? Option A, Battle's sign, mastoid ichthyosis. Option B, rhinorrhea with glucose-negative fluid. Option C, hemotympanum. Option D, all of the above. The correct answer is option D, all of the above. Classic signs of basilar skull fracture include Battle's sign, post-auricular ichthyosis, raccoon eyes, periorbital ichthyosis, hemotympanum, blood behind the tympanic membrane, and CSF leak, rhinorrhea or otorrhea, which tests positive for glucose. Question 7. Testicular torsion is a surgical emergency that requires intervention within: Option A, 24 hours. Option B, 4 to 6 hours. Option C, 2 to 3 days. Option D, it is not a surgical emergency. The correct answer is option B, 4 to 6 hours. Testicular salvage rates are highest when detorsion occurs within 4 to 6 hours of symptom onset. Delay leads to testicular necrosis and loss. Question 8. A patient with a traumatic brain injury exhibits decerebrate posturing. This indicates: Option A, damage above the midbrain. Option B, damage at or below the midbrain /brainstem. Option C, damage to the cerebral cortex. Option D, a positive outcome. The correct answer is option B, damage at or below the midbrain /brainstem. Decerebrate posturing, abnormal extension, arms adducted and internally rotated, legs extended, indicates brainstem damage below the level of the red nucleus and carries a poorer prognosis than decorticate posturing. Question 9. A patient with known cirrhosis presents with massive hematemesis. The nurse suspects bleeding from option A, peptic ulcer, option B, esophageal varices, option C, hemorrhoids, option D, malloy-Weiss tear. The correct answer is option B, esophageal varices. In a patient with cirrhosis and portal hypertension, massive, painless hematemesis is most likely from ruptured esophageal varices, a life-threatening emergency. Question 10. Meningitis is an inflammation of the option A, brain parenchyma, option B, meninges covering the brain and spinal cord, option C, peripheral nerves, option D, ventricles of the brain. The correct answer is option B, meninges covering the brain and spinal cord. Meningitis is inflammation of the pia mater, arachnoid mater, and the cerebrospinal fluid within the subarachnoid space. Encephalitis involves the brain parenchyma. Question 11. Which finding is consistent with an anterior shoulder dislocation? Option A, arm held in internal rotation and adduction. Option B, arm held in external rotation and slight abduction. Option C, patient unable to flex the elbow. Option D, numbness of the medial forearm. The correct answer is option B, arm held in external rotation and slight abduction. In an anterior shoulder dislocation, the most common type, the patient typically holds the arm externally rotated and slightly abducted, resisting any movement. Question 12. A high femur involves option A, retinal detachment, option B, blood in the anterior chamber of the eye, option C, ruptured globe, option D, corneal laceration. The correct answer is option B, blood in the anterior chamber of the eye. A high femur is a collection of blood in the anterior chamber of the eye, usually from blunt trauma. The patient is at risk for rebleeding and elevated intraocular pressure. Question 13. A patient with acute respiratory distress has the following arterial blood gas: pH 7.22, PaCO 258, PaO 262, HCO 324. This represents option A, uncompensated respiratory acidosis, option B, compensated respiratory acidosis, option C, uncompensated metabolic acidosis, option D, compensated metabolic acidosis. The correct answer is option A, uncompensated respiratory acidosis. The low pH, acidosis, with elevated PaCO2, respiratory component, and normal HCO3, no metabolic compensation yet, indicates an acute, uncompensated respiratory acidosis. Question 14. A female patient of childbearing age with abdominal pain should always be evaluated for option A, ovarian cysts, option B, pregnancy status, option C, endometriosis, option D, PID. The correct answer is option B, pregnancy status. Any female of childbearing age with abdominal pain requires determination of pregnancy status to rule out life-threatening ectopic pregnancy before other diagnoses are considered. Question 15. Which diagnostic test is the gold standard for confirming acute appendicitis? Option A, abdominal X-ray, option B, abdominal ultrasound, option C, CT scan of the abdomen, option D, complete blood count. The correct answer is option C, CT scan of the abdomen. CT scan of the abdomen with full contrast is the most accurate imaging modality for diagnosing appendicitis, though ultrasound is often the initial test in children and pregnant patients. Question 16. Sudden, painless loss of vision described as a curtain coming down over the eye is a classic presentation of option A, acute glaucoma, option B, retinal detachment, option C, corneal abrasion, option D, cataract. The correct answer is option B, retinal detachment. The patient's description of a curtain being pulled down or a shade being drawn over their vision is the hallmark symptom of retinal detachment. Question 17. A patient with a history of atrial fibrillation who is not on anticoagulation presents with acute onset right leg pain, pallor, and absent pulses. The nurse suspects option A, deep vein thrombosis. Option B, acute arterial occlusion. Option C, cellulitis. Option D, compartment syndrome. The correct answer is option B, acute arterial occlusion. The sudden onset of the 6ps pain. Question 18. A trauma patient with significant blood loss is in decompensated hemorrhagic shock. Which finding would the nurse expect to see last, as a very late sign? Option A, tachycardia. Option B, narrowed pulse pressure. Option C, hypotension. Option D, tachypnea. The correct answer is option C, hypotension. Hypotension is a late and ominous sign of shock in trauma, especially in young, otherwise healthy patients. Compensatory mechanisms, tachycardia, vasoconstriction, can maintain blood pressure until 30 to 40% of blood volume is lost. Question 19. A patient leaving against medical advice, AMA, must be informed of. Option A, they cannot ever return to this hospital. Option B, their bill will be sent to collections. Option C, the risks and potential consequences of leaving. Option D, the police will be called. The correct answer is option C, the risks and potential consequences of leaving. A patient who has decision-making capacity has the right to refuse treatment and leave AMA. The nurse's duty is to inform the patient of the risks, alternatives, and potential consequences of their decision, and to document this thoroughly. Question 20. Which of the following is the priority assessment when a patient is found to have rhabdomyolysis? Option A, neurological status. Option B, renal function and urine output. Option C, skin integrity. Option D, cardiac rhythm and rate. The correct answer is option B, renal function and urine output. Rhabdomyolysis involves the breakdown of muscle tissue, releasing myoglobin into the bloodstream. Myoglobin can precipitate in the renal tubules, causing acute kidney injury. Monitoring urine output and renal function is critical. Question 21. Priapism is a urological emergency characterized by option A, painful, prolonged erection. Option B, inability to void. Option C, testicular torsion. Option D, scrotal edema. The correct answer is option A, painful, prolonged erection. Priapism is a sustained, often painful erection lasting more than 4 hours unrelated to sexual stimulation. It requires emergency intervention to prevent permanent erectile dysfunction. Question 22. The antidote for acetaminophen overdose is option A, naloxone. Option B, N-acetylcysteine. Option C, flumazenil. Option D, sodium bicarbonate. The correct answer is option B, N-acetylcysteine. N-acetylcysteine, NAC, replenishes glutathione stores in the liver, allowing for the safe metabolism of the toxic acetaminophen metabolite NAPCHI. It is most effective within 8 to 10 hours of ingestion. Question 23. A positive Koenig sign is suggestive of option A, cerebral aneurysm. Option B, subdural hematoma. Option C, meningeal irritation. Option D, cerebellar stroke. The correct answer is option C, meningeal irritation. Koenig's sign, pain and resistance with knee extension when the hip is flexed, and Brodzinski's sign are physical exam findings indicating meningeal irritation, often seen in meningitis or subarachnoid hemorrhage. Question 24. A patient presents to the emergency department with a laceration that requires sutures. During the procedure, the patient states they feel faint. The nurse's first action is to option A, administer oxygen. Option B, place the patient in Trendelenburg position. Option C, immediately discontinue the procedure. Option D, assess vital signs. The correct answer is option C, immediately discontinue the procedure. The nurse should instruct the provider to immediately stop the procedure to reduce vagal stimulation and prevent syncope. After the procedure is stopped, the patient can be placed supine and assessed. Question 25. Murphy's sign is used to assess for option A, pancreatitis. Option B, acute cholecystitis. Option C, diverticulitis. Option D, small bowel obstruction. The correct answer is option B, acute cholecystitis. Murphy's sign is elicited by palpating the right upper quadrant during inspiration. If the patient experiences sharp pain and abruptly stops inhaling, it suggests acute cholecystitis.